Good afternoon and welcome back to GP Video Podcast by Nadia. Today the topic that I have chosen is a topic that we encounter in general practice on regular basis. This is called fibromyalgia. It is a very widespread condition and the misery is that not much is known about it yet, and even the opinion on treatment is very varied because whatever I'm going to tell you is according to the guidelines, but in the treatment part, I really do not agree with guidelines, because what I see in the general world, in the general practice, in the real world is different from what the guidelines suggest, unfortunately. But what guidelines suggest are for the good of people, but unfortunately, because not much is known about it, about its etiology or causal factors, and the prognosis is poor. So even if we don't do proper management with pain medications, I don't know how we are gonna look after those patients. Anyways, we'll start the topic. What is fibromyalgia? Fibromyalgia, number 1 point, is a condition characterized by chronic widespread pain. So chronic widespread pain throughout the body, together with multiple muscular tender points, like just points. So pain all over, but there are multiple tender points as well, as if you hit it somewhere, or is it like the arthritis points or something of some tender points in the body, and associated fatigue. So it is one of the causes of chronic fatigue as well. Sleep disturbance or cognitive dysfunction, when you can find problems with the memories, with word finding and all, in the absence of a well-defined underlying organic disease. So basically, fibromyalgia is a chronic pain condition, which is a diagnosis of exclusion. We do all the bloods, scans, and all that is in our capacity to try and rule out the other causes, the organic causes, the pathological causes of pain. And if we can't find anything and still patient is in pain, still complaining of tender points, still complaining of cognitive dysfunction, still complaining of fatigue, then we come up with a diagnosis of fibromyalgia. The exact number 2 point is the exact etiology of fibromyalgia is unknown. The exact cause of fibromyalgia is unknown. Number 3, there are probably multiple factors involved in the pathogenesis of fibromyalgia syndrome. So though the actual cause is not known, but there are multiple factors, sleep disturbance is thought to be of major importance. So sleep disturbance is one of the major factors that can be related to causing or provoking or aggravating fibromyalgia. Then there is no cause of fibromyalgia. There was a myth that there is a viral cause, but that's not supported by any evidence. Symptoms of fibromyalgia, as I have said before, are vague and generalized and usually wax and wane over time, but seldom disappear. So they can get better, they can get worse, but they seldom, very rarely disappear. Pain is the primary complaint. The pain may be intermittent initially, like on and off, and then progress and become more persistent. The location and intensity of pain may vary from day to day. So you might have, for a few days, you have pain in your elbows, then you have it in knees, then you have it in your thigh, then you have it in the whole right side of the body, whole left side of the body. You may have, it can vary. So it's not one of the signs that we might be able to differentiate it from the physiological, pathological causes is usually it shouldn't be the one side of the body or one spot of the body. It should change places. But there are cases as well that would not change places, but usually it may vary from day to day or week to week basis as well. So factors such as weather or stress may affect the pain. Again, if it's like some people have it more in cold weather, some people have it more with stress. Again, something which is very vague and which can be associated with other conditions as well. Other symptoms include fatigue, sleep disturbance. Sleep may exacerbate symptoms and contribute to depression. So sleep disturbance may precipitate fibromyalgia, and fibromyalgia itself may precipitate sleep disturbance, and that would cause more and more depression. Morning stiffness, which is again one of the signs of arthritis. a feeling of swollen joints with no objective swelling. So when you examine those joints, even physically, or if you scan them, there is no objective swelling. And problems with cognition, such as memory disturbance or difficulty with finding word. Again, we just scan them for everything, all the vitamins, vitamin B12, iron, vitamin D, scanning them for dementia, everything, but there are no cause found, no biochemistry in the bloods is fine, even CT brain is fine, MRI brain is fine, everything is fine, but still there is cognitive deficit. So the criteria to diagnose fibromyalgia is, number one, there are three criteria. Number one is widespread pain index more than 7 and symptom severity scale more than 5 is number one. Symptomatology has been present at a similar level for at least 3 months. So it has been persistent, it has been severe for at least 3 months. And number three, the patient does not demonstrate any signs and symptoms of another disorder that would otherwise explain the pain. So I'll just repeat these 3 points. Basically, a diagnosis of exclusion. So a patient does not have any other cause or any other explanation for these symptoms. Number two, widespread pain index is more than 7 and symptom severity scale score is more than 5, SSS and WPI. So WPI is widespread pain index and SSS is symptom severity scale. And number three is symptomatology has been present at similar level for at least 3 months. So it has been this bad persistently for at least 3 months. Then we diagnose the patient with fibromyalgia. We'll come back to the treatment part tomorrow.